Okay, this is the X-ray of a red arm Tamarin. This is actually Daisy May, or Daisy Gray, sorry. Things to note that the barium has made its way through. She had some abdominal bloating 2 or 3 days ago. Weren't sure. She was actually sitting still, not moving as much as she should have, or usually does. So at that point in time, we gave her a day just to see how she would do. Sometimes she gets gas, and of course that passes. So it just went to out of town, went to Florida to do some help and relief work with the hurricane stuff. And while I was there, I was, her caretaker was getting really nervous because she wasn't moving much. Anyway, so we're in here. I came back yesterday. This is actually part of the barium swallow that I made. Sometimes these guys get foreign bodies, so one of the first things I want to make sure is that she didn't eat something that was stuck in her intestine. And as you can tell here, it's actually making its way out, and this is actually in the small intestine still coming. What I find odd is there's actually a lump right there that's about kidney shaped, and her liver actually does come out way beyond the beyond where it should, and there's actually something here obviously too. So we're gonna probably next get some ultrasound, but the things that I think are more immediate to make this bigger, well, we'll do it right here. As you can actually see right there, she has some spondylosis issues. There's a thinning of the space. Here's some spondylosis here, some spondylosis here. So she really has a painful spine, and she is having some back issues. And if I go farther back, you can see it there and there and there. So, and she's not a young puppy anymore. The good news is I was worried about metabolic bone disease. All the bone densities seem fine. Nice cortices there, no problems. On the next view, anyway, we'll get there in a second. But obviously there's something here. This is most likely stomach in this area here. Most of this is liver. We don't know what this is right here, and that is something that's actually large too. So we'll address that with some ultrasound in the very near future. Okay, let's go to the next view. Let's make it something we can deal with. There we go. Okay. So again, there's the barium. That's the ascending and descending colon. You can actually see that it's made its way out the back right there. There's some poop on her butt right there. Her hips look okay. They're both in place. She is seeming to be showing some pain on her left side, which is over here. And I'm not really seeing much evidence of anything. This here could be a fractured pelvis, but it's on the opposite side, so I'm not really sure how that would work. And the other view doesn't show a fractured pelvis. But anyway, the knees look okay here. She seemed most painful when I was actually stretching out her back for this x-ray. So anyway, let's shrink this down and go back into her spine again. There's your disc spaces right there. Hard to see those over the barium, but that would be a relatively normal disc space. That's relatively normal disc space. That one is not, and not, and not. So a lot of these are really not very normal disc spaces. So I think part of her problem is she actually just has an injured back. A little bit of cardiomyopathy there, but her lungs look good. She's been breathing well. All right, that's her x-rays for now. Okay, so she basically is pretty painful in these areas here and also in her left leg on physical exam and palpation. So we're going to start her on some pain meds. I'm going to continue her treatment. She doesn't need any more barium. We know where that's gone and going. And other than that, I was afraid I was going to see something that's going to require surgery immediately. But anyway, the next point is we're going to ultrasound, get a chance to find a veterinarian here locally that'll help. Get an ultrasound in here, get an ultrasound of this area here, and then we'll take it. She was actually very good for me on this x-ray. On this one here, she was painful. On the lateral one, she sat still and was perfect. I thought I was going to have to sedate her. So she may do equally as well for an ultrasound. All right, that's it for now. Later. Girl, were you ready? Said we just saw Sosha a half an hour ago, and we came straight to Northwood Hills Animal Hospital, where the best ultrasonographer on the coast just happens to reside, and hang her shingle. Anyway, so she's never done a monkey before that we know of, but we have worked together and we trust each other, so we're gonna go ahead and try this for this girl. Her is so pretty. Oh, it's a girl.